My name is Ifoma Augustina Okaimi, matric number 21/52HG141. I will be starting the presentation for Group 12, Knowledge Management System Model for Health Sector. I'll be starting the presentation by defining some key terms. The first one is knowledge. What is knowledge? Knowledge is the full utilization of information, skills, and understanding that have been acquired, either through education, experience, or awareness. It encompasses all the facts, insights, and the ability to apply this information, skills, and understanding we have in various contexts. Another term is knowledge management. Knowledge management goes beyond computer or technology basis. It involves the whole processes, strategies, and the tools involved in the identification, capturing, and organizing and disseminating of knowledge. That is the whole processes involved in the full utilization of knowledge. We might wonder, why do we need to manage knowledge? Well, for example, if we have money and we don't manage this our money, we might end up spending it irrelevantly, and at the end of the day, the need is still there. So, similarly, knowledge needs to be managed in order to produce effective results for it to be used properly. So, knowledge management system is required in all factors. In fact, it's essential in all factors, be it law, education, health, and so on. But we are going to be focusing on knowledge management system on health sector. We all know that health is wealth, and in today's world, there are a lot of diseases, sicknesses, people are dying here and there, and some of these deaths are as a result of lack of knowledge, lack of proper knowledge management in the health sector due to errors and here and there. So, knowledge management system is really required in the health sector. My partner here will tell us more as to why knowledge management system is essential in health sector.
The healthcare sector. The CORALS model is used to help improve care and outcome. This system includes information of a patient's medical history, current medical condition, medication, and test results. With this model, doctors and nurses could be able to provide solutions to the patient through treatment and care. This model could also be used to create a sharing knowledge platform through which doctors and nurses could share information about new treatments, researches, and better practices.
For the healthcare sector, we propose the knowledge management system model that includes the following: capturing. Capturing is the first step in knowledge management. It involves capturing information. It is a system for capturing knowledge from patients' record, medical journals, and healthcare related sources. One way to apply knowledge capture in the healthcare system is through the use of electronic health record, that is EHR. EHR are digital records that contains information about a patient's health, including medical history, medications, and tests. One way to apply knowledge capture in the healthcare system is through the use of clinical decision support. There are different types of clinical support. One type is called computerized physician's order, that is CPOE. CPOE system allow healthcare providers to enter orders for patients' care, such as prescription directly into the EHR. This helps to reduce error. Another type is called alerts and reminders. This system can help to ensure that important steps in patients' care are not forgotten and overlooked. EHR, CPOE, reminder and alerts are just a few ways knowledge capture could be applied in the healthcare system.
How knowledge could be organized in an health sector. Once data is captured, it would need to be organized in a structure, easy to understand manner. This could be achieved by categorizing factors, data based on different factors such as patient demography, disease categorizing, and treatment type. There are a few modes of organizing, which is clinical patient guideline. Clinical patient guideline develop evidence based on clinical patient guidelines for various condition treatments and procedures. Medical database create certain medical database for research finding, clinical treatments, and case study. Health information protocol establishing online protocol for patients to access reliable health information. Training and education developing online course and resource for health center.
Analyzing knowledge management in the health sector involves various approaches, including number 1, content analysis. Examining the content, documents, reports, and databases to identify patterns, trends, and gaps in knowledge sharing and utilization within healthcare organizations. Number 2, expert interviews. Conducting interviews with the healthcare professionals, managers, and knowledge management experts to understand their perspectives on knowledge sharing, practices, challenges, and opportunities. Number 3, surveys and questionnaires. Administering surveys or questionnaires to healthcare staff to gather quantitative data on knowledge management processes, including knowledge sharing behaviors, attitudes, and perceived effectiveness. Number 4, case studies. Investigating specific healthcare organizations or projects to gain insights into their knowledge management strategies, successes, and failures. Number 5, network analysis. Using network analysis techniques to visualize and analyze the structure of knowledge networks within healthcare organization, including identifying key knowledge brokers and knowledge flow patterns.
Sharing and storing of knowledge in an healthcare sector. So sharing is all about making information accessible to the people who need it. The organized data will be shared amongst authorized individuals or departments, and this can be facilitated through a digital platform, ensuring the users can access the information. It can even be available for patients to view their own records, although it may be quite difficult to ensure that the information is accurate and up to date due to constant changing. In an healthcare sector, we're going to have lots of patients with their records and information, and all of this information is going to be constantly changed. Another challenge is balancing the need of information sharing and protecting patients' privacy, such as Health Insurance Portability and Accountability Act, to protect patients' information. In the healthcare sector, protecting patients' information is very vital, and we don't want those information to be leaked out to the public. I'm also going to talk about storing of knowledge in an healthcare sector. So, storing being a vital part of any knowledge management system, healthcare is definitely not an exception. One of the factors to consider when it comes to storing healthcare information is the volume of data, as healthcare information is large and complex. For instance, in an hospital, which is an healthcare sector, we're going to have patients with their records, and then the storing of these records and information is going to be very large and complex. So another factor is the need for quick and easy access to information. So in the healthcare sector, it is very critical to be able to access information quickly and easily, as this can impact patients' care. So in this case, using a cloud-based storage system with strong encryption and backup facilities will be ideal due to the sensitive nature of healthcare information.
Benefits of knowledge management in the health sector. It includes improved patient care by effectively managing and sharing knowledge. Healthcare provider can ensure that patients receive the best possible care. Better decision making. By having access to accurate information, healthcare professionals can make more informed decisions about treatment and care. Enhanced collaboration. By sharing knowledge, healthcare professionals can work together more effectively to provide the best possible.
Means creating a treatment plan or conducting research. It can help improve patient care by ensuring that healthcare professionals have access to latest research and best practices. It can also enhance collaboration and information sharing among healthcare teams, leading to more efficient and effective decision making. It incorporates evidence-based guidelines, best practices, and protocol into routine clinical workflows to ensure consistent and high-quality patient care. Overall, implementing a knowledge management model in healthcare sectors can contribute to best healthcare outcome and improve patient experience.
How knowledge management system can help in updating the health sector. Knowledge management system can help in updating the health sector by keeping them updated about current practices and also adding to their current knowledge. To be more precise, there are several ways in which knowledge management system can help in updating the health sector. Knowledge management system can help in updating the health sector by dissemination of up-to-date information, continuation of education and training, timely access to evidence-based practices, standardization of practices, quality improvement of initiatives, support for research, innovation, enhanced communication and collaboration.
Effect of lack of knowledge management system in the health sector. 1. Poor clinical decision. Low quality knowledge can lead to poor clinical decision, which can endanger lives. 2. Wasted time. When information is unorganized and difficult to access, employees may spend more time looking for resources, which can waste time. 2. And 3. Overloaded worker. Healthcare worker may be overloaded with information but struggle to find what they need. 4. Inconsistent information. If knowledge is hidden or difficult to find, employees may end up recreating information which can waste time and introduce inconsistencies.
Now we have challenges that limit the knowledge improvement on healthcare because of lack of leadership, we have the lack of methodology and organization cultures. Now we have the benefits of healthcare on knowledge management. We have the virtual discussion forum, we have the peer reviews and collaboration, and we have the collect feedback. Now I'd like to explain this one by one. Virtual discussion forum is when the healthcares are online discussing on the improvements on the knowledge management. We have the peer review and collaboration. This is where it happens physically, and you guys bring out your ideas and start saying as in how the healthcare is going to improve. You have to collect feedback. After all this, when you are done, just collect the feedback and make a processes and start the processing on how to develop the knowledge management on healthcare. In conclusion, knowledge management plays a vital roles on healthcare, promoting better collaborations between practitioners and the improving patients.
Security, the securing management, knowledge management in the health sector. Securing is like or preserving patient's data. And then we have encryption. Encryption is a way of converting data into a form that is unreadable without the use of a special key or password. It makes it harder for unauthorized users to have access to data. And there are several types of encryption, including symmetric and asymmetric encryption. Symmetric encryption uses the same key for both encryption and decryption, while asymmetric encryption uses a pair of keys for one encryption and another one for this encryption. And in other this encryption, we have access control, which are the rules and procedures that determines you can view and modify healthcare information. This control can be based on user rules within the organization, the level of clearance or other factors. One type of the access control is a rule-based access control, which is RBAC. RBAC, rule-based access control, allows for different levels of access-based users rules, such as doctor, nurse, and all these health administrator.
Benefits of knowledge management in health sectors. Knowledge management in health sectors offers numerous benefits, including 1. Improved patient care. Access to relevant, up-to-date information allows healthcare providers to make better decisions, leading to improved diagnosis and medical treatment outcomes for patients. Efficient decision making. Knowledge management system facilitates the sharing of best practices and evidence-based guidelines, helping healthcare professionals make more informed decisions quickly and efficiently. Number 3, reduced medical errors. By centralizing and standardizing knowledge, healthcare professionals can minimize the risk of medical errors and adverse events, ultimately enhancing patient safety.
Number 4, enhanced collaboration. Knowledge management fosters collaboration among healthcare professionals, enabling them to share expertise, insights, experience across discipline and departments. Number 5, continuous learning. By capturing and disseminating knowledge, Healthcare organizations promote continuous learning and professional development among their staff, leading to a more competent workforce. Number 6, cost saving. Streamlining process and avoiding unnecessary duplications of efforts through effective knowledge management can lead to cost saving for healthcare organizations.
Innovation, regulatory compliance, and overall, knowledge management plays a crucial role in enhancing the quality of care, promoting collaboration, and driving innovation in the health sector.
In conclusion to all said, this model enhances decision making, it improves service delivery, and also facilitates the learning and research in the healthcare sector. It needs to be user-friendly and adaptable to cater to the evolving needs of healthcare professionals and patients. Knowledge management plays a vital role in healthcare by promoting better collaboration between healthcare practitioners and improves patients' outcome. Like every part of our culture, the healthcare community is now more interconnected by technology than ever. Healthcare organizations now have the opportunity to share in their findings on a scale that has never been seen before. Thank you.